This one is a small outbreak in the DRC, but there are already concerns about our preparedness. From a health workers' perspective, how come we are ill prepared when we've survived a global pandemic? How come health workers are not ready for this, as Brown says?
Yeah, I think, and thank you, Fred, for bringing that up. I think the problem is, as much as we went through COVID, and you could excuse COVID being the first major zoonotic outbreak of disease that we experienced in such a large scale in Kenya. I think the fact that we've not learned our lessons and prepared our facilities is probably the biggest failure out of the COVID pandemic. In fact, this facility was being prepared for Americans.
Yes.
So you could see the American government already had started preparing for what happens if an American working in DRC, most of them work in those minerals and mining companies, what happens to them if they get sick? And that's why they had taken measures to already prepare a quarantine facility. For us, with our government, you ask yourself, okay, fine, we read about Ebola constantly in the DRC. Where are our facilities? Where is our long-term plan? Where is our healthcare infrastructure being upskilled to be ready to get these Ebola cases? In fact, this might be a blessing in disguise because it shows you what a government that puts its people first usually does in advance. Because remember, this facility has been prepared for Americans by Americans in advance of even them getting Ebola patients.
Do we have, I'm just curious, do we have any quarantine facility specifically for Ebola in Kenya, for Kenyans, or for any other patient who may cross over into Kenya?
As a healthcare worker, I can tell you most of our facilities just function the way they do. But then I saw recently the Ministry of Health senior officials saying they've earmarked and demarcated certain facilities, but you know, just designating a facility as a quarantine facility doesn't make it a quarantine facility. It requires special preparation. It requires almost internal restructuring of how the facility works, where patients are handled, who works there, what's their compensation, because you can imagine being, for example, a healthcare worker like a nurse who's nursing a baby at home. You can't just randomly find yourself at a very high risk level facility like that. You should be reorganized, restructured, redeployed. So I think the Ministry of Health just appointing on a map different points and saying, oh, you become a quarantine facility, you become a quarantine facility, doesn't make it a quarantine facility.
Already existing infrastructure,
already
existing
hospitals. Yes.
But Brown, you gave us a picture of how risky Ebola is. Paint to us a picture, how different